I met a man who lost his way. He said, I'm so born the son of a sailor who never showed me his face. So I said, quit your talking, you're sideways walking. Time to find another path to take. Quit your whining, your bloodshot crying. Faking like you're dying never pays. Just go home, you need you some home. Boy, you need you some home.
With 19,364 people, Elbert County is the 90th most populated county in the state of Georgia out of 159 counties.
The largest Elbert County racial ethnic groups are white at 63.8%, followed by black at 30.3%, and Hispanic at 5.3%.
In 2015, the median household income of Elbert County residents was $35,388.
The median age for Elbert County residents is 41.3 years old.
Hi, my name is Karina Drake, and I am the medical assistant, office manager, translator here at Mercy.
Hi, I'm Bob Ward, and I own Ward's Pharmacy.
Hi, I'm Janine Breedlove. I have been in the Elberton area for about 3 years now, and we are at First Baptist Church in Elberton.
My name is Cindy Paramore. I'm a registered dietitian and certified lactation counselor here at Elbert County Health Department. I have been working for the WIC program for 13 years, actually next month. And we are here in my office where I do the assessments and the counseling here at the Health Department in Elberton.
Hi, my name is Miranda Allman. I'm from Hartwell, Georgia, and that's 30 minutes away from Elberton, Georgia, the granite capital of the world. And I worked at Walmart on 966 Elbert Street in the pharmacy. And lots of people, like, if you work at Walmart and you're on a budget, you're going to go to McDonald's or Taco Bell, because you can get deals. Or you'll go to Pizza Hut and you'll split the lunch with another co-worker. But yeah, they don't have much selection.
So our WIC participants get a produce voucher, and we do encourage that fresh produce. We currently only have 2 grocery stores in Elberton. We had 3, one including Bilo, that did close. So most of ours shop at Ingles. Few of ours shop at Save a Lot. We don't have a really big grocery area at all in our Walmart. It's not a super Walmart. Farmers Market, we sometimes will do farmers market programs. We don't do it here. We don't do farmers market checks here. I wish it was something that we did. Most of ours, if they're going to get fresh produce, it's going to be at Ingles.
Medical care hasn't changed that much. There are 7 doctors in the medical center, and they are the premier medical facility in town.
So the only doctor's office that we have here in Elberton is the medical center, and that's just general physicians. So they do sick visits and health checks for the kids and shots and that type of thing. But for OB care, we have a list that we give out a referral, and most of ours go to an OB doctor in Athens. And there's a whole list of those, and then the closest one to us is Dr. Richard White in Royston, and many of ours go to him. Just obviously it's closer. Seems like majority deliver at Athens Regional, but yeah, they do have to take a drive to get to their OB care.
We are a 3rd generation retail pharmacy in Elberton, Georgia. My grandfather bought the store in 1938. It was originally Cleveland Matthews and Ward. We've been in this location since 1957. We are one of the few drugstores probably left in the United States that still has a fountain. We average around 130 to 160 scripts a day. We answer as many questions as we can, and we try to help folks as much as we can.
Okay, So definitely we mainly target, those nutritional needs, which is what we really emphasize and feel like is much needed. Just based on research, we know that a lot of our lower income population, suffer from anemia and just inadequate nutrition, not having the proper foods to put on their plates. And so we really, really target towards providing that population with those healthy foods that's on those WIC vouchers that are iron rich and full of those nutrients that many of our low income participants population does lack.
There's an increase in all three of them, and particularly, believe it or not, in the African Americans, I noticed that some of them were becoming more hypertensive, even though they were on medicine. Their diabetes were getting bad, and I just think they don't have the education. Diabetes patients, they are the worst, because the pharmacists, they don't have the time to do pharmacotherapy. And I worked with one, she loved it, and that's what she wanted to do, but in retail it's just unheard of. You don't have the time, so they could definitely benefit from a clinic like Mercy.
Okay, so definitely number one is going to be the obesity, and so one of our key things with our postpartum moms is trying our best to get them back to pre-gravid weight, and so that's something that we really, really try to work on. But obesity is one of the number one reasons that qualifies many of our patients to be considered high risk because they're in that obese zone. We do see, I think following that, the next most common thing that we see would be gestational diabetes. We do see quite a bit of that, and then followed by the hypertension we don't see quite as much of.
And as far as contraception, they need a contraception lesson down there, because a lot of the women were very young and having babies over and over and over, and our tax dollars were paying for them. And they would come into the pharmacy, and I don't think either there wasn't raised right or no one ever told them, but the babies wouldn't have on socks or the proper clothing in the wintertime, and when it was cooling, they would get sick over and over.
So other than WIC services housed in this health department, we also do tons of family planning. So birth control is done here. We have a teen clinic, and the teen clinic is located towards the back of our health department, where they can enter the back side versus the front main area, just to have that private area to come in and request their birth control. Of course, we do our the STD checks is something that we do a lot of, and immunizations. So, obviously definitely here, but the nutrition education that we do is strictly here at the health department for WIC clients, okay? So we don't really do a lot of nutrition ed for maybe family planning patients and that type of thing. So we also have a registered dietitian at the health department, at the hospital here at Elbert Memorial Hospital, and I'm pretty certain she's not 5 days a week, but it's a part-time position, but she does, a lot of outpatient, eds and counseling and things like that. Some of ours also get some nutrition education from our wellness center with a personal trainer that actually runs the wellness center. She's not a registered dietitian and doesn't have previous nutrition schooling, but she does do a lot of that at our local wellness center. And those are the three main areas in our community where people can get the nutrition education.
The only place I know that you can get that kind of help is going to be at the hospital. They do have a dietitian that comes in like twice a week, and you can make an appointment with her if you need that kind of help with nutrition.
But what about the poor people? They don't have anything to do, nutritional. There's no education, no classes offered. They need more education. I think it would have helped in a lot of areas.
You have the wellness center, and then you have a gym that is on the Calhoun Falls Highway. The wellness center is over by the hospital. It's not that bad. It's only like $20 a month, or probably less than that. Because folks I talk to talk like it really doesn't cost them anything to go over there. they open at like 5:30 in the morning and close at like 8 o'clock at night. So they have hours that are flexible enough for everybody to use the facility.
But we do have quite a few options here in a small town like Elberton for exercise. We do have, I already mentioned, the Wellness Center, and many go there. And then we also have a couple of parks that have really good walking trails. So one is called Sutton Park, and it's located behind the hospital. And they've got it set up to where there's like 3 circles, and if you go all those circles, I think it's like 1.5 miles. And a lot of my patients tend to utilize the walking trail more than they do gym memberships. And so that park is actually located just around a lot of houses and where a lot of my clients kind of live. So I see that utilized most often. They like to stroll their babies and that kind of thing. And I mean, obviously it'd be recommended that, you know, you kind of walk in partners at that park, but there are a lot of people that do walk alone as well there. It is located behind the hospital. Most of them just do their simple walking at parks, or I've had them up and down driveways around their homes. Those kinds of things seem to be utilized most often. And when they do implement, we set goals with our patients. So if one of my patients does set a goal of, I'm going to start trying to exercise by walking and strolling my baby 20 minutes, whatever, 3 times a week, whatever their goal is, you know, we do a checkup. We follow up in about 3 months to see, you know, hey, how is that going? Are you doing the exercise that you talked about? Can we get your weight today? Kind of see where things are at. And oftentimes those that really have met those goals, we do see some really good changes.
Here at First Baptist Church, we offer a program that is called the Upwards Program. It is for children K through 5, and they come on Saturdays, play basketball. It's an all-day event. We have a rock gym. It's a recreational outreach center that is offered to our families here. We do have an upstairs walk.
A track.
Yeah, like a track. And so that is offered to families as well.
Those that are indigent that fall between the Medicare and the Medicaid groups, the Salvation Army has funds that are available for these people. The Baptist Church also has facilities available. And there is a Lighthouse Church facility that has funds that are available for these people too. Lighthouse actually has housing for them if they need it. They do an excellent job of taking care of battered women and indigent families that need a place to stay and need some help just to get back on their feet.
So for our teens, they are allowed like 1 free STD exam. I believe that's under the age of 21, I think. They're allowed 1 free exam. Otherwise, all of our STD exams are $80. Birth control, currently we're doing free Nexplanons. The arm implant, that's something that our medical director really pushes, just because it's just a really effective birth control. We don't see as many get pregnant on the arm implant as other birth control methods. So we do a lot of Nexplanons, but all services are not free at the health department. I think that's a misconception. A lot of people think that, you know, all their birth control and their checks and their exams are free. You know, we bill Medicaid for what we can, and then there are some things that there is a charge for.
This has to do with backpacks. We service children in public school systems who are in need of food on the weekends. If we see a child that is in need, on Fridays they bring their book bags to the office, and we fill it with a Walmart sack, Ingle sack full of food, and then they have meals over the weekend. So designated Sunday school classes bring like the meat and then the fruit, breakfast. There is a list of guidelines. They have to have a protein, they have to have a fruit, they have to have good carbs, and then water. We serve water.
And how many students are being served right now, do you know?
I want to say the last number I heard was about 13, but
Okay.
I'm not for sure.
Okay, and then how does the process of them being selected work?
Through recommendations of teachers or faculty, staff of the school.
I have met a lot of women, and when I talk to them, They don't understand a lot of things. They're not getting the care that they need, and they don't have Medicaid all the time, you know, just because the kids are getting peach care. And I really think that would be very beneficial. I found that a lot of our patients, men and women, they don't have any income and any health care coverage.
Yes, so to qualify to become a Mercy patient, you have to have no insurance. You have to be on the 150% of the poverty line. Also, you have to provide a proof of income if you have some. You have to provide ID and proof of residency to prove they're living in the local county. So in the past, Mercy was open for all different counties, and Elbert was one of them. The difference is that now we only provide services for the 5 counties surrounding Athens. And the reason is because a lot of the times our patients will travel far away to come from where they were living towards Mercy. And by the time the patients will come to Mercy and finish their appointment, it was really late at night. A lot of times the patients couldn't afford to come here for being a low income, couldn't afford to pay gas, or a family member who would be willing to bring them all the way here. So that was one of the reasons why now we only serve the 5 counties. But it's a big need for having another Mercy clinic in other different counties, that we have a big chance of helping people who can't afford pay, you know, a doctor's appointments, or even have health insurance. Once you become a Mercy patient, you normally will be able to get primary care appointments. We'll be able to provide you also with different specialties like gynecologists, orthopedics, rheumatologists. We have a big list of different specialties that we can help here for free for our patients. In the same time as well, if we provide some medications for free. We have a program called where we can provide patients for a low rate of $10, and we can get some of the medications like insulin that are a little bit higher and our patients can afford. We also are able to help patients with dental services and with behavioral health services.
Yes, I worked in Franklin County for 10 years, and we were huge into farmers market. And so what happened in Franklin County is each family would get a $30 set of checks to purchase fresh produce. And I would have the local farmers come to the health department and set up in the parking lot. It's usually like 4 or 5 times during the summer season. And we would call clients to come in. We've got farmers market today. You can come in between these hours. And what they would do is come in. We would print their $30 checks. I would then take them back to our classroom, and we would do some type of lesson on fruits and vegetables, and we often would do like a food demo. Oftentimes the farmers market would have some of their fresh produce washed up and kind of ready for sampling, so that they could kind of see, kind of what things their kids liked, so that they would know what to spend their vouchers on. But they would fill their recyclable grocery bag that we issued with $30 of fresh produce. And so we got a lot of good feedback from that, just new ones they discovered their family liked. And it just got some more fresh produce in the home. So that's something that I have mentioned to my district director would be great for Elberton. As I mentioned earlier, there's not a lot of resources for fresh produce in our county other than just the local grocery store. So doing something with a farmer's market here would be absolutely excellent. And then just furthermore, when we do our nutrition assessments, we always are seeing a lack of fruit and vegetable intake. So again, this would just be something we could do to kind of move that goal forward with a better intake of those fruits and veggies.